Stroke, this cruel disease, does not always signal with loud, easily recognizable symptoms. Sometimes, it chooses to attack in a very silent way, sneaking through seemingly small manifestations, subtle changes that even those who have faced it may miss. These hidden enemies, if not recognized, can take away the golden opportunity for us to intervene promptly, minimize the consequences, and even prevent a tragedy from happening again. Today's video was created with a single goal, just for you. We will not only list 10 silent signs of stroke, but will also analyze each sign with you, clarifying why they are extremely important and often overlooked, especially for those who are on the recovery journey or are at high risk. Please be patient to watch until the end, because every piece of information you grasp in the next few minutes is the key to help you be more confident, more proactive to protect your priceless health and regain peace of mind in life. Classical symptoms of stroke and the fast METECOD. Most of us know the typical symptoms of stroke, but let's review them. Stroke often has characteristic signs that appear suddenly, such as numbness in the face or limbs, difficulty speaking or slurred speech, weakness on one side of the body, loss of balance, difficulty swallowing. Watch until the end of the video to see a list of 10 silent signs of stroke that many people often ignore. To recognize quickly, remember the FAST rule. F face. Ask the person to smile. If one side of the face is drooping or paralyzed, that is a warning sign. A arm. Ask them to raise both arms. If one arm is weak or unable to be raised, this is a potential problem. S. Speech. Ask the person to say a simple sentence. If they have difficulty speaking, slurred speech, or are unable to speak, this is a sign of a stroke. T. Time. If you notice any of these symptoms, call 911 or take the person to a medical facility immediately. Time is of the essence, and delay can cause irreversible damage. Introduction to silent stroke. In addition to the classic symptoms, we need to learn about silent stroke. Many studies show that this is the type that accounts for the majority of strokes in the United States. This means that many people have it without knowing it, and therefore do not receive timely treatment. Untreated stroke is a major cause of dementia. Let's explore 10 symptoms of silent stroke. But first, please support the channel by liking this video, subscribing, and turning on the notification bell to update the latest content. Please share the video to spread this important information. Help prevent and save many lives. 10 signs of silent stroke. Sudden drowsiness. This is not the usual feeling of tiredness after a long day, but an intense, irresistible urge to sleep that comes on suddenly, even when you have just woken up or are in the middle of an activity that requires alertness. This unusual drowsiness can last for a long time, making you drowsy, having difficulty concentrating, and it is clearly different from your usual state of lethargy. This deep and unusual drowsiness is sometimes not the only manifestation that the body warns. Nausea and vomiting. Which can be accompanied by a sudden feeling of nausea, even leading to vomiting, without any related digestive problems such as food poisoning or motion sickness. This symptom is especially noteworthy when it appears with a feeling of dizziness or lightheadedness, creating an extremely unpleasant experience and impairing the ability to orient. This internal imbalance and discomfort can sometimes manifest itself in a more dramatic way through seizure. The sudden onset of a generalized or partial seizure in an adult with no previous history of epilepsy. This can be an important warning sign that an area of the brain is being damaged by a lack of blood flow. This occurs when abnormal electrical activity in the brain is triggered by the effects of a stroke. While seizures are a dramatic and easily recognizable physical manifestation, sometimes the body reacts in ways that are less alarming but unusually persistent, such as hiccups, although usually a normal and harmless physiological phenomenon. Persistent hiccups that continue for hours or even days without any signs of abating can be a sign of a stroke, especially when they affect the respiratory centers in the brainstem. These are not your typical short-lived hiccups and are often resistant to common remedies, indicating an underlying abnormality that needs attention. In addition to these unusual and seemingly unprovoked reflexes, strokes can also directly cause specific sensory experiences, such as pain. The pain associated with a stroke can be sudden and severe, often localized to one side of the face, a specific limb, arm or leg, or even spread to half of the body. The quality of this pain is often described as burning, electric, or prickling, and it is not relieved by common pain medications. Sometimes it can also manifest as a sudden, excruciating headache, unlike any headache you have ever experienced before. This extreme discomfort and disorientation, or the neurological disruption that causes it, can sometimes overwhelm the body's ability to maintain consciousness, leading to fainting, a sudden, complete loss of consciousness, also known as fainting. Syncope, especially without an obvious trigger such as dehydration, hypoglycemia, or rapid change in position, requires immediate medical attention. If it occurs in someone with stroke risk factors, such as high blood pressure, diabetes, heart disease, or is accompanied by other underlying symptoms, the level of alarm is increased. When you wake up from a fainting episode, or even if you don't faint, you may notice a decline in your cognitive functions, especially noticeable in memory loss. This can manifest in a variety of ways, from difficulty recalling recent events and small details of the day, creating disturbing gaps in your memory, to a profound inability to form new memories after a suspected stroke, also known as anterograde amnesia. You may find yourself in a familiar place with no memory of how you got there, or forget the content of a conversation you just had. This significant disruption in cognitive processing and storage can also manifest as a profound sense of disorientation or an altered perception of your surroundings, such as dizziness. This is more than just a fleeting feeling of lightheadedness or dizziness. Stroke-related dizziness can be a sudden, intense feeling that the world is spinning or turning around, a symptom of true vertigo, or a severe feeling of imbalance that makes it difficult to stand or walk, leading to falls. It can occur suddenly without any apparent environmental cause, leaving you feeling extremely unsettled and anxious. Such severe dizziness can easily lead to a broader state of confusion about a person's perception of the environment and their internal state, which is disorientation, a sudden, acute state of confusion in which an individual is uncertain about the time, day, month, year, does not know where they are, spatial disorientation, or even who they are, personal disorientation. This may be accompanied by an inability to recognize familiar people or understand simple questions or instructions, which is often closely related to a decline in short-term memory and attention span. When complex brain functions are so significantly disrupted, the abnormalities may extend beyond cognitive confusion to include more alarming changes in the level of neuropathic manifestations. In less common but equally serious cases, stroke can trigger acute psychiatric symptoms such as severe agitation, delusions, believing things that are not true, hallucinations, seeing or hearing things that are not there, or sudden and profound personality changes, even in people with no previous history of mental illness. These striking and unusual changes in mental status, which appear suddenly, require urgent medical evaluation to determine the exact cause and provide timely intervention. Causes of stroke. A stroke occurs when the blood flow to the brain is interrupted and is often caused by the following risk factors, many of which can be controlled or changed. High blood pressure, hypertension. This is the leading and most common risk factor. Continuously high blood pressure damages the artery walls, making them stiff, less elastic, and more likely to form blood clots or rupture, leading to stroke, cardiovascular diseases, atrial fibrillation. This is a common type of heart rhythm disorder that causes the heart to beat irregularly, making it more likely to form blood clots. These blood clots can travel to the brain and block blood vessels. Other heart diseases, heart failure, heart valve disease, or congenital heart defects also increase the risk of stroke by affecting blood circulation and the ability to form blood clots. Smoking. The toxic chemicals in cigarette smoke directly damage the lining of blood vessels, promote atherosclerosis, plaque buildup, and increase the ability of blood to clot, thereby significantly increasing the risk of stroke. Diabetes. Diabetes, a condition of prolonged high blood sugar levels, damages the vascular system throughout the body, including the blood vessels in the brain. Blood vessels become less flexible, making them more susceptible to narrowing and blockage. Dyslipidemia, commonly known as high cholesterol. High levels of LDL, bad cholesterol, in the blood lead to the accumulation of plaque inside the artery walls. This process narrows the lumen of the vessels, blocking blood flow to the brain. Obesity and a sedentary lifestyle. Being overweight or obese is often closely linked to and exacerbates other risk factors such as high blood pressure, diabetes, and dyslipidemia. A sedentary lifestyle also contributes to poor cardiovascular health. In addition, non-modifiable factors such as age risk increases with age, especially after age 55, a family history of stroke, or having had a stroke or transient ischemic attack (TIA) also increase the likelihood of a stroke. Recognizing and actively managing modifiable risk factors is extremely important for stroke prevention. Stroke T18 and T-stroke treatment is a battle against time, requiring rapid and accurate intervention. The main goal is to save the patient's life, minimize brain damage, help restore affected functions, and, importantly, prevent recurrent strokes. The specific treatment will depend on the type of stroke, cerebral infarction, or cerebral hemorrhage, and when the patient is brought to a medical facility. 1. Emergency treatment, optimizing the golden time for ischemic stroke. Due to blood vessel blockage, the goal is to quickly restore blood flow to the area of the brain that is deprived of oxygen. Thrombolytic drugs, e.g. RTPA, if the patient arrives at the hospital within the golden time, usually within 3 to 4.5 hours of the first symptoms. This drug can be injected intravenously to dissolve the blood clot. Endovascular intervention for mechanical thrombectomy in cases of large blood vessel occlusion or when the patient arrives later than the window for thrombolytic therapy. The doctor may use specialized instruments inserted through the artery to directly pull or suction out the blood clot. For hemorrhagic stroke due to ruptured blood vessels, the focus is on controlling the bleeding, reducing pressure on the brain, and stabilizing the patient. Treatment may include strict control of blood pressure to reduce the risk of further bleeding. In some cases, surgery may be necessary to remove a large hematoma causing compression or to repair a ruptured blood vessel. A.g. clipping a cerebral aneurysm, removing an arteriovenous malformation. 2. Rehabilitation, the journey to regaining life. After the emergency treatment phase, the rehabilitation process plays an extremely important role in helping patients improve their impaired or lost abilities. This process usually includes physical therapy, helps restore mobility, muscle strength, balance, and coordination. Occupational therapy helps patients relearn skills needed for daily activities such as eating. Personal hygiene, dressing, speech therapy, improves communication problems, speaking, understanding, and especially the ability to swallow to avoid complications of pneumonia due to aspiration. 3. Preventing recurrent stroke, protecting the future. This is an indispensable part of a long-term treatment plan, aiming to minimize The risk of stroke occurring again. Positive lifestyle changes, including adopting a healthy diet, reducing salt, saturated fat, increasing green vegetables and fruits, maintaining regular physical activity appropriate to health status, completely stopping smoking and minimizing alcohol. Take medications as prescribed by your doctor. These may include antiplatelet drugs such as aspirin, anticoagulants if you have atrial fibrillation or other risk factors, blood pressure medications, diabetes medications, and cholesterol-lowering medications. Control underlying medical conditions well. Regularly monitor and effectively treat conditions such as high blood pressure, diabetes, atrial fibrillation, and other cardiovascular diseases. Strict adherence to treatment plans. Regular checkups and proactive management of risk factors are the best ways for patients to recover effectively and reduce the risk of future strokes. Prevention and healthy lifestyle. The most effective way to reduce the risk of stroke is to develop healthier habits. A balanced, active lifestyle helps maintain a healthy body with few risk factors. Maintain a scientific diet, exercise regularly, and monitor your health regularly under the guidance of a medical professional. In short, silent stroke. Don't wait until it's too late. Facing the danger of stroke, which can silently take away your smile, voice, and even life in the blink of an eye. Each knowledge of early recognition is an invaluable shield. Hopefully, the 10 silent signs that we have just shared are not only information, but have truly given you the strength and confidence to protect the precious lives of yourself and your loved ones. If you find this video valuable, please do not hesitate to click the like button, share with your relatives and friends to spread this important knowledge together. And especially, please click the subscribe button and the notification bell icon so you don't miss any health knowledge update videos from us. All your comments are extremely valuable. Please leave them in the comments section below. Once again, thank you very much for taking the time to watch. We wish you good health and peace. Goodbye, and see you again in the next videos.